candidate for this very nice and clear introduction. Before asking the first opponent to speak, I would like to ask you whether you're ready to defend your thesis.
Meneer de rector magnificus, op uw gezag en met machtiging van het college van decanen en volgens besluit van de promotiecommissie van de faculteit der geneeskunde sta ik gereed mijn proefschrift dat de titel heeft Compliance with Childhood Leukemia Treatment in Indonesia, Influence of Socio-Economic Status on Treatment, Refusal or Abandonment te verdedigen ten einde de graad dokter te verheffen.
I translate this, she says yes. Next to me in a row, the first two sitting over here are both the promotores, Professor Veerman and Professor Sutario, and then in a row you see the opponents who will discuss the manuscript, the results of your thesis. In the final end is sitting Dr. Klaas van der Pol, former director of the Koningin Wilhelmina Foundation, and he initiated the outreach program, so very welcome. Thanks, ma'am. And now I'd like to give the mic to the first opponent, to Dr. Scott Howard, Director of Clinical Trials International Outreach Programs in Hughes Children's Research Hospital, Memphis, USA. But before doing so, I once more would like to thank you very much for coming to the Netherlands and taking part in this ceremony. The floor is yours.
On the authority of the Rector Magnificus and by virtue of my rights, I would like to first congratulate you on a beautiful thesis and an excellent presentation. And also, I want to thank you, dear Saskia, and my friend Anjo for inviting me, and my esteemed colleagues for letting me participate in this ceremony, and for the fantastic hospitality here in Amsterdam, which is unparalleled, I have to say. A few questions about the nurse's role. The first is the attitude of the nurses toward the poor patients versus the rich patients any different from the attitudes of the doctors? And is nursing care any different in the prosperous versus less prosperous?
Yes, well, thank you very much for your nice compliments on my thesis and for arriving here to be in my promotion. It is very much appreciated. And during the course of our writing all the manuscripts in the past years, you have been a big inspiration to us with your manuscripts and also with the nice presentations you gave, full of inspiration during the SciUp congresses. And now I would like to answer your question about the attitude of the nurses and if there is a difference in care given toward poor and prosperous patients by the nurses. In fact, as you can read in my thesis book, the system in the Dr. Sarita Hospital is as follows. You have a division between the VIP ward, the first, second and third class wards. Children